Good morning, good afternoon, and good evening. Guten Tag. I am happy to be here, and we are going to talk about COVID response in Peru. Peru is a really very wonderful country that has many nice places in the Amazon forest, in the highlands, in the Andes, and the coast. We have the longest side wave in the world, and several other interesting things. The people in Peru is very charming and has an array of ethnic origins. We have ancestors from indigenous people that came to this land 20,000 years ago, but also is mixed with the mestizos, which are the majority of the people, plus Black, Asian, Middle East, European people that have this such a very wide diversity of origins in Peru. Peru is a country where we have the surface that is 3 times Germany, 10 times Rwanda, several times, no, I mean 50 times Rwanda, 10 times Nepal. We are the largest country in the South America behind Brazil. And we have also 33 million inhabitants in the country. And we have also 24 out of 28 climates in the world. So we have a variety of climates in the country because we have a coast, we have a highlands, we have an Amazon forest. We are going to talk about the COVID-19 health impact. And to do so, we need to start by talking about preparedness. Was Peru, the world, and Latin America prepared to respond to a pandemic? This is the big question that we have to answer first. Were we prepared or not? And my first answer, and very clear answer, is that we were not fully prepared as a world, as Latin America and as Peru, to respond to public health threats like a pandemic. And this is the result of this index that we launched in 2019. There were several organizations that put together this index that you can find in internet, and this index combines indicators for six areas: for prevention, detect, response, health systems, and international agreements, and risk in the environment. So there are 6 areas where we analyze the indicators. So this index is a sort of impartial tool that gets first level indicators, combine them, and give a result. We present this. We launched this in Washington on October 2019. It means a couple of months before the pandemic started. It was declared in March 2020, but it started already in December, as everyone knows now. But in that meeting, we were claiming the countries to do something, to use tools, these and other ones, like the joint external evaluations and other approaches, to identify the weaknesses in our countries to do something to prevent this global pandemics. We didn't know that it was going to happen, but we knew that one pandemic was going to happen in the near future. These are the results. The average the score for the world was 40 out of 100 points. It means the world was 40% prepared for dealing with this. The highest country was USA, that got 83%, and the lowest was Equatorial Guinea with 16. But we realized afterwards that there are also other factors that affect the response to one pandemic. One of them is leadership and importance of the science to make decisions. So, as you can see, Europe and US and Australia are the most prepared, but not totally prepared. And Africa has the less prepared countries. But in Latin America, the preparedness was in the medium level. Peru has 49 out of 100 points. It means it was in the half of the table. But in February, we, with a group, we prepare an short study comparing the IHR self-report that is mandatory by the WHO and the Global Health Security Index. And as you can see, we are not going into details here, but as you can see on the left is the IHR self-report. On the right-hand side of the screen, you have the report of the index. We try to put the indicators at the same level in each of the reports. And as you can see in the index, in Peru, this is only for Peru, we have several areas with red highlighted. It is because we had the bad results, the worst results for this analysis were in these areas where we highlight in red. So these areas are those listed here. I am not going to go through all of them, but as you can see, all of them are very important to prevent, detect, and respond to a pandemic. For instance, epidemiology workforce, we were very low. And if you don't have epidemiologists or the capacity to do surveillance, to do case investigation, to do contact tracing, you can't stop the pandemic at the very beginning. There was also weaknesses in the lab system. We will see later the details for that. The data sharing, our surveillance systems are not integrated, and we didn't do the joint external evaluation that could have told us where were our weaknesses and what to do about them 5 years ago, because we were even, Peru was one of the countries where the tool that is being used in more than 100 countries was tested. And we proposed to use this to have a real JEE and then prepare an action plan, but we were not heard by the authorities. And we didn't, simulation exercises are very important to prepare people. Emergency operation centers are key to analyze data, to discuss the strategies and take decisions, and this was not working properly. Biosafety is, of course, very, very important, and maybe that explains the death of even health personnel, especially at the beginning of the pandemic in Peru. So, what are the results of this lack of preparedness in the world? That we have this very bad pandemic, And in Latin America is in orange. We have the highest rate of death in the world. So 48, almost 50%, half of the death by COVID, due to COVID, are in the Americas, including the USA and Canada. But if you exclude that, we still have a very high number of deaths. This is absolute numbers. This is not a rate. We are coming to that. So to me, a lack of preparedness was one of the factors that led to this bad situation. We have this number of deaths is related with lack of preparedness. In this recent analysis, we can see that sadly for us, Peru has the highest death mortality rate, I mean the cumulative death per 100,000 people. And we have 556 or 50 or 560 people dead out of 100,000 people in the country. It means almost the 0.5% of the Peruvian population, 0.5, half of 1% of the total population of Peru has died in this year and couple of months due to COVID. This is very, very bad. And when you look at the incidence, cumulative incidence, you don't find Peru. I mean, Peru has a rate of incidence, but it doesn't come in this chart. Why? Because we were not identifying the cases. This is why in Peru, some of the people who work in this area, we don't trust in the number of new cases. What we trust is in the number of deaths reported by one death classification system, but not in the number of cases. For instance, yesterday we had 1,500 cases and 400 deaths. It doesn't make sense. It would mean if we accumulate several days that we are having like almost 30% of the 30% of case fatality ratio, which is not true. The case fatality ratio in Peru is around 3%, like in other countries. It's not higher. It's people, the health personnel, the medical doctors are doing well when they treat patients at the hospitals. So the case fatality ratio is not high. The reason for this difference between a high mortality rate and a low incident rate is because we are not counting the number of cases. And this is very bad because if we don't count the cases, we can't stop the dissemination of the disease. Why then? Why these bad results? There is a combination of social determinants, the weak health care system, and a wrong approach to deal with the pandemic, and a very poorly implemented response. This is based on some indicators. The social determinants of health we have done a very good job in economic growth, but we don't have the same. We haven't done the same with the equity. So we can see here that Peru has increased steadily the GDP over time. It is very good because Peru now has a higher GDP than before and is doing well in economic terms. Even more, the poverty, the monetary poverty, has come down very steadily as well in the last 20 years. In the last 10 years, especially, we have come from 30% to less than 20% for people living under $5 per day. And in people with extreme poverty living with $3 per day, it is less than 5%. So we have economic growth and reduction of the poverty in the last 20, 30 years. So we have improved there. But when we see inequality, there are several ways to measure this, Gini and this and that. This is a way to measure inequality by analyzing, the share of the wealth that the population has in the country. If you take the 10% with the highest national income, the top 10% of people with the highest income, they get almost 60% of the wealth. If there is another chart where you can see that the 50% of the poorer people, you divide the country in two halves. The first half is the people who earns more money, and the second half is the people who earns less money. The bottom 50%, they get only 10% of the wealth, of the income. So there is a very big inequality. And this is quite similar in other countries of South America, as you can see, but maybe Bolivia, and Bolivia is the one that has the less inequality, but it's not so different. So one other problem is we grew economically, but we didn't redistribute the wealth that we get as a country. And when we go and see what is the share of public health expenditure in the country by the GDP, we see that Peru has the lowest share of public health expenditure for health, measured by divided by the GDP. So we have around 3.4% of the GDP of Peru is going to public health. And in other countries like Bolivia, Chile, and Brazil, the GDP for health, the expenditure of the government in public health is higher. So just to summarize, the last years, the governments forgot to adequately invest in health, and now we are paying the price in some way. Social determinants, for instance, poverty is still 20% at the beginning of, this is at the beginning of the pandemic. Informal economy, this is a very important indicator that has consequences later. The 70% of the economy in Peru is informal. So you don't get social benefits. You don't get social health insurance. You don't have retirement funds, and this and that. So the inequality is high. The budget, the money that we dedicate to education is less than the average in the region, which is around 6%. Other countries is even 10%. the, the households are almost 20% of the houses have overcrowding. So it's very difficult to deal with a pandemic that is transmitted by person to person if you live in overcrowded household where people has to go out to get the money for the day, and that also contributed to the situation we are describing. And in the other side, the healthcare system has a gap that has been measured in the last 20 years, and we have, I mean, the Ministry of Health has plans to reduce this gap in human resources. They have identified a number of specialists in different areas and even family doctors that we need for the next, for now and for the next 10 and 20 years. And we need to invest in that, but we have a big gap. Also, the gap goes to the what we can call local or provincial hospitals and in the first care facilities. In first care facilities, we don't have a big gap in terms of number of facilities, but in terms of equipment and human resources. At the beginning, we had only 150 ICU beds. No? It means 0.5 ICU beds per 100,000 people, which is very, very low. Now we have 2,500, 2,500 ICU beds. It's a very huge, it's almost 20 times the number of ICU beds that we had at the beginning. And at the beginning, there was only one lab, the national lab at the National Institute of Health, doing the molecular test for the country. And there were only 100,000 hospital beds dedicated to COVID patients. There were more, but the hospitals and first care level facilities were closed due to the pandemic. So why, again, Peru COVID response? The earliest response was very, very good, very quick, and very according to the public health strategies that we have to use. Right after the WHO state that this was the novel coronavirus was an international health threat, the country published the national response plan. It had only $2 million as a budget, but at least it means that the country was thinking this could be something important and we need to deal with that. The next thing they did was to do active surveillance at the point of entry. They were even identifying people that was going to travel from China to Peru. But the problem maybe was at the time we didn't know, we didn't think that the virus could come through other countries, through Europe. And this is what happened. The first confirmed case in March 6th, there were cases before, but we didn't find them. The first case confirmed came from Europe. That person went to France, Spain, and other countries, and was diagnosed here, and all the family was tested, and some of them tested positive, and they went to isolation and this and that. And then when that happened, the government quickly responded. They closed the school right away. 2 days after that. 3 days after that, they closed borders, which was a very big decision because we haven't done, as many other countries, that before. You don't close borders easily because it has a lot of consequences, economic and social consequences. So, but the government was very decided to do that. They did in the right way. They they started 1 week later the national lockdown that lasted for 110 days, which was too much in my point of view. They also gave economic stimulus and relief bonds, which were necessary for these people who didn't have a formal job. So they need money to buy food, and so it was important. But there was a problem we will see later. The other problem was, one problem was that they decided to close all the hospitals but the COVID hospitals. And the priority was on increasing the number of intensive care units, beds. So we had only 150, we were going to need many more. That makes sense, but the problem is you need to do other things before. At the beginning, this is the beginning. At the beginning, the popularity of the public support for the president and the ministers was very, very high. 87% of public support is very high in Peru and elsewhere. And the ministers, sometimes the people that doesn't know them, they had a very big public support. So they have a capital. They have trust from the people. You know? They could do a lot with that. As a consequence of the national lockdown, Peru reduced the mobility to 72% less mobility after the lockdown. This is the normal times, and this was after lockdown. So it was working. The problem is we had the whole country closed. But the problem at the very beginning was located in some areas. And as a consequence of the informal economy and the bonus distribution and lack of money to buy food and this and that, the people was leaving the cities, Lima, the capital, and other capital cities in the urban areas to the rural areas or to small cities to look for protection in their hometowns, because in Peru there is a lot of migration to Lima, the capital, and to big cities. So with the lockdown, they didn't have money to survive. They had to go back home, and they were by walk because they were not allowed to go, so they were fighting with the police and this and that, and in very bad conditions. They had camps to stay for very poor places to stay for a while and then look for ways to go back home. And most of them were walking. So we can say the COVID walkers. We call in Spanish the caminantes, which is walkers. But the COVID stimulus checks or bonus were around $171 US dollars. But that was good because it was enough for some people to get going for some time, for some days and weeks. The problem is at the very beginning, they decided to 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 send them to cash the checks in a specific day according to the last digit of their ID. So if my ID is ending in 1, I have to go on March 31st, and this and that. So what was the consequence? Long lines, crowding. We don't have a picture of the interior of the bank, but within the bank, there were people crowding. And as you know already, one of the main way of transmission is aerosol. So after this, the curve of cases and death was increasing. And the other thing is we were not using the right indicators. WHO has published a definition of COVID death, saying that COVID death for surveillance purpose is any death of a person who has been confirmed by molecular test or is a probable case. Probable case means clinically, radiologically, with epidemiological nexus and that. But Peru didn't accept that and was defining death only, COVID death, only for those who had a molecular test positive before dying. So by the end of May, one day we had officially almost 70,000 deaths, and the next day we had 184,000 dead. This is the number, the last one is the number I have shown in the previous chart, where we have the highest mortality rate in the world. So from one day to the other, we climb 3 times almost in the number of cases. And this is the official curve of death right now. So we had the so-called first wave in from May to August. In August, we had the number of cases, the number of deaths was decreasing very steadily. And then came the November and December, and we didn't, even though many people was telling the government, you should prepare, you should increase the communications, you should reduce the commercial activities of the end of the year. You should take measures to avoid the people to getting together at the end of the year holidays. But the answer was we need to move the economy, to stimulate the economy. These people need to work, need to get together. So they didn't close the commercial centers, and we saw. I didn't put here many pictures, the crowds of people in the going to the commercial centers, to the malls, and so that was another moment for for the for the for the pandemic to increase. So there was a increased risk because of this behavior. Plus the end of the year parties, the end of the year family gatherings, and as a result, in January we had this peak, and then came the Easter, and then we had another peak. Then Mother's Day, another peak. And we are going down now. We are reducing the number of cases very steadily now. And in my hypothesis is that in these two cases, in August and now by the end of May, it started at the end of May. The reason for this reduction is that the virus doesn't have where to go, because the susceptible people in these corridors, among the people who is getting together, is not enough. Many people are now has been infected, and other people, which is a very good news for Peru, is are being vaccinated. And we have charts showing that vaccination in senior citizens and in medical doctors is going down. COVID rates and COVID death are going down in these two populations. So it means vaccination works. It means the government is taking seriously that measure and is doing a very good job now with vaccination. What went wrong? Well, the first thing is that maybe before this is the lack of equity, no? The social determinants problems, but the lack of country preparedness against public health threats was really a factor that contributed very much to this result. The other thing, in my point of view, is that the approach was more in the biomedical hospital base over public health. Of course, it is a very good thing to increase the number of ICU beds, but you have to put one commission to do that, but to increase the public health measures, communication, contact tracing, increase the number of tests. This is what you have to do. No? So many of the strategies, well, I mean, the whole approach and the strategy was not based in scientific evidence. We have, for instance, that the Minister of Health was proposing to consider the serological test, which is not the appropriate tool for this, to be considered equivalent to a molecular test. And even in one of the conferences, he said that the Ministry of Health of Peru was going to propose this to WHO. This has not foundations in health evidence, in science evidence, scientific evidence. The other thing was that the Ministry of Health was promoting the use of non-tested, non-approved treatments like hydroxychloroquine and ivermectin. And the problem with this is not, ivermectin doesn't cause very important side effects. The problem is that the people was trusting in these treatments, because there is a treatment. If I take some drops, this number of drops of ivermectin, I will be protected. So they opened the Pandora box, because self-treatment in Peru is a very big problem. and the people was buying ivermectin from different labs, and they were thinking that, but by taking these drops, they were protected. So this is the problem. The problem is not the drug itself, is the consequence in the behavior. I can go out, I can meet people because I am protected. And I have seen cases of that. Of course, the risk communication was very bad, was even in non-existent. The social participation, I am talking mostly about the beginning, which is to me the cause of the results. Many of these things have improved, but at the beginning there was not the social participation, the local leaders, the ethnic leaders, the unions. They were not called to be part of the discussion and of the response. The pandemic, the monitoring indicators, I have said something, I can say more, but this is, I mean, we were using a bad indicator because we were not measuring the number of deaths, so we didn't know that the measures we were taking were not working. If we knew, we could have changed on time. And the lab the lab capacity, we had only one, but there were several other private and academic labs that were offering to do it, to run the test for free. And the government was hesitating and saying, no, the private, no, the academic. And result, we didn't expand the number of tests, we didn't identify infected cases on time, we didn't stop the pandemic at the very beginning. The contact tracing was almost non-existent. I say weak because there were several teams, but they were not enough to deal with that. The lockdown, the problem is it was nationwide, and we needed to do perhaps specific areas lockdowns, not national lockdowns, because there were areas where the virus was not there, and that caused only economic and social problems. The closing of the first care level led to the increase of the number of other diseases that were not treated and end up in death, not for COVID, but for instance, cancer, and complications of diabetes, hypertension, and that. The senior medical doctors were sent home, and they haven't come back yet, even though they are vaccinated already. The risk communication I was talking about, there was almost nothing, but by July or August, the government started a campaign saying that, oh, sorry, COVID does not kill alone. Don't be complicit. So they were putting the responsibility to the person who has COVID. Of course, it is true that if you go out and come back and transmit the disease to a vulnerable person, like a senior citizen, of course, it is true. But now you were saying, you were telling the people, so you are the guilty of this COVID case, of this death. So this was very, very bad. And the government, the high level authorities used to give press conferences almost every day at the beginning, and then from time to time, but they were long, repetitive, confusing, and without clear messages. So race communication was very, very bad during this pandemic. The management skills at the very beginning, then after some months, the management skills were improved, and they were organizing better the different interventions, the inequity, social determinants of health, the healthcare system. And another important thing in Peru is the political instability. You can imagine a country in the middle of a pandemic with 3 presidents, 3. I will not explain why, but we had 3 presidents during this pandemic. It's a lot of instability. And we have 4 people that came, that were working as a ministers during this period. I mean, there were 5 terms with 4 people. No? And now it's more stable. The last minister is working for almost 4, 5 months now, and they have improved the organization, working with people that has already learned how to deal with these interventions, and the vaccination strategy is approved, that it has improved. So, summarizing this combination of factors I was talking about, we're defining what we can call a perfect storm, or a syndemic. Is an epidemic combined with socio-economical and other health-related problems that make the impact of a pandemic worse. What to do? Of course, is strengthen the public health approach. Many people is talking about public health, but we need to improve this approach, because when some people say here, politicians, people who has some credibility in the media, they are referring to the medical care in public funded institutions, but public health is more than that. It's this multidisciplinary field where we are working hard to promote health, to prevent diseases, to organize prevention service programs and medical services, and to analyze the policies that we need to do to improve the health of the population, with the participation of the community, of the leaders in the community. So this is, to me, what is needed now. Of course, actually use science-based public health decisions, accelerate the vaccination rate. You can see here, I have said all of that, but what is most important is to have this culture, to change the culture to a culture of preparedness. Prepare before, to prevent, to be very stressed, and during a new peak or a new wave, and do not have the right interventions to stop the expansion of the pandemic. So we need to prepare, and this is very important in Peru right now, because we are going down in the number of cases, in the number of deaths, but also we are having a new president. These days, we are the electoral commission is counting the votes, and we will have a new president by the end of July. But this is democratic election. No, this is a democratic election, and we will have a new administration in place from August onwards. So we need to tell them you should go this way to protect all of us. And in this specific regard of I'm not talking about the health system, which is another topic that we can talk another time, but about how to prevent the impact of pandemics like this one. We need to improve the capacity of the country, and one of the ways to do that is to start by capacity assessment using the tools that they are already there, and prepare action plans to ask the new government to compromise in increase the investment in public health and medical health care, in both, and to differentiate public health. If we need to do disease surveillance, this is not like hiring doctors for the hospital. It's totally different. And so we need to be clear with the politicians to tell them there is a difference and you should invest in public health, even though you are not going to inaugurate a place, an infrastructure, but you're going to work for the future of the public health. And of course, in Peru, we have a Peruvian CDC, which is not a branch of the US CDC. It's a strategy that many countries have taken in Asia, in Europe, and in Africa. They have CDCs and a strategy to articulate prevention, detection, and response. It's not related in any way to CDC of USA, which is a very good institution. And we had this approach at the very beginning, but now the CDC in Peru that we have already is just, I'm saying just not because it's not important, but just an epidemiology office. But CDC is not an epidemiology office. Use epidemiology, but to articulate these three things. So we also think that we need a fund to do this, and of course strengthen the national laboratory system, and many other things, but this is the basics. Well, this is something I wanted to tell you, and thank you very much. I leave you with this poem by one of the best Peruvian poets, and we have still too much to do. Thank you.